Hello everyone, I'm Dr. Howie Chen from Joint Shantou International Eye Center. Today's topic is part 4 of ocular examination. We will talk about several ocular imaging techniques and electrophysiology of the eye. The learning objectives for you are to master the application of ocular imaging techniques, including fundus photography, scanning laser ophthalmoscope (SLO), optical coherence tomography (OCT), B-scan ultrasound, ocular biometric, and electrophysiology. Fundus photography can document the morphology of retina. This allows for subsequent studies such as image grading, multi-time point comparison, and quantitative analysis. It is also useful in medical education and communication with patients. On the posterior pole fundus photography, we can see the optic disc, retinal vessels, and the macula. The peripheral retina can also be captured with the rotation of the eye and the fundus camera. SLO has the advantage of wide-angle viewing of the retina. The viewing angle of SLO is up to 200 degrees, which is much bigger compared to the 45 degrees of the traditional fundus camera. Therefore, some peripheral retinal lesions, such as retinal breaks and degeneration, can be well documented. But the color of SLO is a pseudo-color. The light of SLO is a laser which has only a narrow wavelength. Usually, there are 2 or more lasers with different wavelengths, and their images are merged to a single one with pseudo-color. OCT can provide high-resolution cross-sectional image in vivo. It uses the technique of optical coherence to detect the signal refracted from the retina. The OCT image can be grayscale or pseudo-color. With OCT, we can identify the retinal layers. The high refractive layers are nerve fiber layer at the inner retina, photoreceptor and retinal pigment epithelium layer at the outer retina. The low refractive layers are neuronuclear layers, including the ganglion cell layer, inner nuclear layer, and outer nuclear layer. Furthermore, the quantitative analysis of OCT images can provide some important parameters for diagnosis and follow-up of many disorders, such as retinal nerve fiber layer thickness for glaucoma. OCT can not only be used in retinal imaging, but also for documenting the anterior segments. ASOCT provides high-resolution cross-sectional images for the cornea, anterior chamber angle, iris, and the lens. The cornea imaging can show the keratoconus, retinal scars, and cornea dystrophy. Images of the anterior chamber angle are commonly performed in angle closure glaucoma. Anterior chamber biometric is helpful for refractive surgery. Imaging the iris can document iris cyst. Imaging the lens informs the surgeon of the location of intraocular lens. There are 2 types of ocular biometric techniques: ultrasound A-scan biometric and partial coherence laser interferometrics. Ultrasound is useful in optical media opacity, while partial coherence laser interferometrics has the advantage of high speed, high resolution, and non-contact. Both of them can measure the central cornea thickness, anterior chamber depth, lens thickness, vitreous depth, and axial length, which are important parameters for calculation of intraocular lens, refractive surgery, and monitoring the growth of the eye. As mentioned before, ultrasound has the advantage in the condition of optical media opacity. It is usually used to demonstrate the retinal morphology in severe cataract or vitreous hemorrhage. It can also tell us whether there is any retinal or colloidal detachment. Another important application of B-scan ultrasound is to delineate the internal structure of the ocular tumor. Visual function can be assessed by psychophysical measures such as visual acuity and visual field, which require getting response from the patient, and electrophysiological techniques, which are objective tests. There are several electrophysiological modalities: electroretinogram (ERG), multifocal electroretinogram (MERG), and visual evoked potential (VEP). They are useful in assessing the visual function in uncooperative patients, such as children, differentiating the cause of visual impairment, and diagnosis of retinal and neural disorders, including retinitis pigmentosa and glaucoma. ERG records the retinal response to light stimulation. The recording is made between an active electrode either in contact with the cornea or a skin electrode placed just below the lower eyelid margin and a reference electrode on the forehead. With different patterns of stimulation, ERG can differentiate the function of the cone, rod, and bipolar cells. We can obtain a negative A wave and a positive B wave, whose amplitude and implicit time are important parameters. Multifocal ERG can assess the function of different regions of retina. VP records the electric activity of the visual cortex created by visual stimulation. The stimulus is either a flash of light, flash VP, or a black and white checkerboard pattern on a screen that periodically reverses polarity. Pattern VP. We can use this to investigate optic neuropathy. In this section, we talk about fundus photography, SLO, OCT, B-scan ultrasound, ocular biometrics, and electrophysiology. You need to understand their applications. That's all for today. Thank you. Here are some references for further reading.